The National Institute for Communicable Diseases says South Africa could be out of the COVID-19 fourth wave within 10 or 11 days. Last month, ahead of the lifting of the curfew, the presidency said the peak of the fourth wave, driven by the highly contagious Omicron variant, had subsided at a national level. To unpack this further, we're joined by NICD Acting Executive Director, Professor Adrian Purin. Professor Purin, good evening to you, and thank you for your time. Certainly good news that we're well on our way out of this fourth wave of COVID-19. Given where we are in terms of the scale of infections that we saw, the admissions, is the effect of the pandemic tapering off?
Yes, I think overall, I mean, the numbers were quite substantial compared to the previous resurgence. So it's good to see that we are now coming out of the fourth wave. At least I think overall in the country is still in the fourth wave, if you like, so we're not really out of the woods. But the numbers are certainly starting to decline. We can see that in the absolute numbers as well as in the so-called positivity rate. And I think also very good for us as a country as a whole is the fact that, for example, the hospital services were not under undue pressure as they were in the previous resurgences in terms of the numbers of admissions, serious disease, the ability to sustain oxygen capacity and bed capacity. I think it was really helpful in this particular resurgence. So I think that there have been overall really useful things that have come out of this particular resurgence. So I think it bodes well for now.
What have we learned from the current variant, that's the Omicron variant, about how this virus is progressing and potentially what we can expect for upcoming waves of the pandemic?
Yeah, well, I think some of this is not always predictable, but I think what this particular variant did illustrate was that we had some major concerns around certainly transmissibility and evasion. But I think what held was the fact that, in fact, we did not have severe disease that led to the overwhelming of our particular hospitals. I think that is something good that we've learned. And that I think is a result of the fact that we've had previous exposures. I think that that's very important. So previous natural infections and or in combination with vaccines certainly played an important role, not necessarily in preventing infections because we saw the large numbers, but certainly played an important role in preventing severe disease. I think that's an important lesson that we've certainly learned. Because it also means that we have to be on our guard because, again, it's very difficult. The virus evolves continuously regardless. So I think what is important that comes out of this is the fact that we need to continue to encourage people to vaccinate, especially in specific age groups, specific conditions, for example, and also to encourage those people who are hesitant about being vaccinated to really come forward to be vaccinated. Because I think the way in which we can really prevent further developments with regard to the evolution is really wide-scale vaccination. So again, I think boosters have also, not necessarily in South Africa to the same extent, certainly does play a role, but has not done so in South Africa. But I think it's important, at least in South Africa, to encourage people not only to vaccinate, but if there are opportunities to have booster vaccines, to actually have that as well.
One of the big conversations is around the mutation of this virus, and the last Omicron virus, the variant rather, turned out to not be as lethal as was initially predicted. Do you think that that is a pattern we're likely to see going forward? And I know it can be a hard one to call sometimes.
Yes, it is a very hard one to call. I wish we could say that this is a good example of the variant that we would like to have in the sense of certainly causing infection, but not overwhelming our systems in terms of serious disease. And it's a virus that we can therefore have, in a sense, has adapted to the current scenarios for us to, for example, lift certain particular restrictions or to open our economy, for example. So it's very difficult to predict that. So again, critically within South Africa, as you know, there is the network of laboratories that are continuously monitoring the evolution of this particular virus. So I think that's going to be really critical for us in the next months, if not years, for us to ensure that we are aware of what is in circulation, what the implications are. But I think it also highlighted, I think, for us the fact that although there were 50 mutations, I think the overall effect was not as disastrous as we thought it would be predicted. Of course, this is very different in Europe and the United States, but then again, those are large numbers, which are probably going to be overwhelming the health systems. Whereas here, I think we've been fortunate. I mean, that although we've had large numbers, it did not lead to overwhelming our systems. But I think it's really time for us now to say, well, we're at level 1, for example. We did not remove the curfew. So these are the next steps in terms of how do we start adapting to this particular virus, or the virus adapting to us as well, in terms of our immune responses and non-pharmaceutical interventions.
Of course, at different waves of the virus, South Africa has either found itself in a position where it is learning and studying patterns in other countries and benchmarking its responses against what those countries have done. Omicron has been somewhat different because we seem to have taken the lead when it came to bearing the initial brunt of the severity of cases and getting through that fourth wave where Omicron is concerned quicker than other countries. What position does this leave us in when we then begin to talk about a fifth wave?
Yeah, so I think it's important that we really build up on this. In fact, it really just emphasizes the importance of readiness, and readiness at different levels in terms of ensuring our communities are aware what is in circulation, what is required of us in terms of our behavior. It's important to have laboratory services ready to be able to monitor, and our hospital systems as well, again, at a national and provincial level, to ensure that we have the necessary bed capacity, oxygen capacity, staffing. And of course, really, I think still really, really important is really to get our vaccine campaign to really cover the vast majority of South Africans. I think what had happened in South Africa was that very rapid displacement of the Delta variant. Whereas I think in the United States and the UK, it was really different in the sense that they had a mixture of both Delta and Omicron at the same time, which probably complicated their approaches. But I think if we had a clear-cut focus in terms of what we need to do in South Africa, those are the points that I would like us to emphasize and focus on.
Acting Executive Director at the NICD, Professor Adrian Purin.